Hi, my name is Jennifer Peters, and I completed my literature review on treatment options for adolescents with depression. Over the last decade, rates for adolescent depression has increased from 8% to 13.3%. An estimated 3.2 million adolescents aged 12 to 17 in the United States had at least one depressive episode in 2017. Healthy People 2030 has dedicated multiple goals to address this issue. Those goals look at prevention, diagnosis, and treatment. The first important goal would to be increase adolescents who show resiliency. Resiliency has been shown important because it's a modifiable factor that when taught in childhood, it decreases an adolescent's chances of having depressive episodes. The second goal would to be increase the amount of youth that are screened for depression at their well-child checks. Currently, only 8.5% of children are being screened at those visits. The goal for Healthy People 2030 would be 13.5%. Screenings at well-child checks are one of the most cost-effective, efficient ways to screen for depression, so it's a good goal to increase. And lastly, we want to increase the number of adolescents who are getting treatment. Right now, approximately 60% of adolescents who experience depression are not receiving treatment, and that's as of 2017. My theory that I used for my intervention is the tidal model. It was produced in 1998 by Phil Barker. It's a middle range nursing theory. In it, he says that individuals are represented by three domains, and that is the self, world, and others. And all of those, our well-being, our mental health, is all kind of directed by those three domains. So how we interact with ourselves, how we interact with the world, and how we interact with those around us. So the theory had two major assumptions. One that is change is the only constant. Things are always going to change, and we need to know how to roll with the punches and kind of be resilient with those changes. And the second one is that people are their stories. We need to be looking at people as individuals and really taking into account their life story as to how they got to where they are right now. This theory works really well with my intervention of interpersonal psychotherapy because both of them focus on patients as individuals, and IPTA uses those life experiences and relationships, and it really focuses on those and how we can improve those in order to improve the adolescent's mental well-being. My intervention was interpersonal psychotherapy. ITPA was shown to be an effective treatment for adolescents with depression. It had a greater reduction in symptoms compared to that of the control groups. It teaches patients relationship skills and shows them how relationships affect their mental health, and we give them tools and ways to cope with those relationships. It's relatively brief. It has a 6-week option and a 12-week option. They meet once a week. It can either be provided in individual therapy or as in a group therapy setting. So it's really flexible for providers on how they want to provide it. The literature review that I used, my level 1 was a meta-analysis that looked at the effectiveness of interpersonal psychotherapy in the adolescent population. I must note that all of my studies looked at adolescents between the ages of 12 and 19, and they were all diagnosed with mild to moderate depression. There was no severe depression in any of my studies, so this really focuses on that mild to moderate depression. So the level 1, all 10 studies that it looked at showed a significant decrease in depression scores when IPTA was used. The effect size was 1.19 compared to an effect size of 0.58 in the control group. So that was a large improvement over the control. My level 2 was a randomized control trial. It also looked at the effectiveness of IPTA. Results were also in favor of using the treatment. And interestingly enough, depression rates were even lower at the 6-week follow-up as compared to immediately after the treatment. So it's good to know that IPTA does have some longevity with it, and rates it does continue to increase as we move forward. And my level 6 was a qualitative study that looked at the experience of depression by adolescents. So a group of adolescents was asked, how they were feeling, what do they think caused their depression, what do they think their options are, those kind of things. And it really took into consideration their individual experiences. And then the study authors broke that down into 4 broad categories that no matter who answered, they all fit into these 4 categories. And those categories were: 1, that suffering is experienced as overwhelming. These adolescents, they feel overwhelmed. They don't know what to do. They don't know how to help themselves. They need coping mechanisms. The second one is experience of loneliness and isolation. They feel like nobody loves them, that they're different, that they need to pull away. And IPTA really teaches them how to focus on those relationships and how to pull them back and how to use them to increase their mental health. And then the third one was struggling to understand the suffering. They weren't understanding why they were chosen to have depression. They didn't know what they did wrong. And then lastly, they saw therapy as a last resort. So we really need to focus on letting adolescents know that therapy is nothing wrong with it, that it can be a good tool. We can use these studies to show, depression rates are climbing. So we need to have effective treatment options for these adolescents. Because it is so flexible, it's a great tool to have for the treatment of mild to moderate depression in adolescents. It's best suited for outpatient settings, so schools, mental health clinics, group therapies, family therapies, those kind of places. And this is my reference slide, and I hope you guys enjoyed the presentation.